individual. I am lucky enough to have both ABPA and CPA. The CPA to me feels the most serious of of the diseases, in that I have cavities in my lung, which are full, I think, of Aspergillus. I've got different strains. I've got quite a lot of resistance within those strains. I probably initially had ABPA, which is the allergic form of aspergillosis. I've had severe asthma since being 6 weeks old. Times have been very unwell, lots of missed school. Medications came along, it improved. But anyhow, I say I had the children, my chest up and downish, but generally not very good at all, really. Then around 1998, it got much worse. I think it was that time, it could have been earlier. I noticed blood in sputum. I went to the GP, he thought TB, he tested me for TB, came back negative. And I don't really think it was terribly well followed up. I continued to be unwell. Eventually it was followed up. I did go and see a consultant who diagnosed bronchiectasis, but nothing is really explained about bronchiectasis. 2012, particularly unwell. I do remember I was going to a sewing class every week, and I couldn't breathe. And given that all I'm doing is walking from the car park to the classroom, and I couldn't breathe properly, it was all snatchy. And my friend said to me, "You're not right, your breathing's weird." And I thought, yeah, she's right. So I came home, I went to the GPs, and luckily there was a locum on who sent me off to MAU. Blood gases, lots of bloods taken, X-ray, and then the doctor came back eventually and said, "Oh, you've got shadows on your lungs." And I felt better because I'd obviously just sat in MAU for 4 hours. I felt better. I said, "Oh, it's fine, I've got bronchiectasis, that's okay." And the poor doctor was saying, trying not to be too alarmist, but saying, "You can't ignore this." So he said, "You'll need CTs." CTs were done, and I was referred back to a consultant. And then it was, "We're going to have to do a lung biopsy. We sort of think we know what it is, but we're going to have to do a lung biopsy." The result came back, "Yes, you've got aspergillosis, and we'll start you on itraconazole right now and refer you to NAC." I was 55 at the time, I'm 63 now. I was 55, and Prof. Denning said, if you hadn't been referred, the amount of Cs, you would be lucky to have 5 years. And I was shocked because I was still going along thinking of it in terms of it's a sort of asthma thing, is it? You know, I didn't know really what it was. It will get better. I'll have some different treatment, different antibiotic type thing like the itraconazole, and I will get better. And you know, no, it's not that simple. Having these conditions, and apart from those, obviously I've got bronchiectasis, I've got asthma, I've got loads of food allergies, loads of allergies to, I don't know, hay, grass, cows, all sorts. The impacts on my life, and it's difficult to know whether it's aspergillosis or the other things sometimes, the other chest conditions, they're huge. I tried to go back to work when my daughter was, I think, about 11. I went to the job centre and I'm thinking, I can't do OT anymore. I can't work in a hospital or with psyche patients who smoke. And at that time, I don't know about now, were smoking when you have group sessions, they were smoking. I can't do it. I'll have to go back to my previous job of shorthand typing. I went to the job centre and I was told, "Oh, I don't think you'll be able to work. You'd better claim a benefit." I thought, "Oh, well, thanks." So I did claim benefit, and I do get, I think it's ESA. It's a help. You know, I've used it to buy my automatic car that was needed. But it's not like working. You've got no status, you've got no wage, no proper wage, got no pension, apart from state pension. So it's not the same. So that's a big impact. I was so pleased when I managed to go to college. And then it sort of feels, well, that was pointless because I can't do the job. During the time when it was really not good at all for the bleeding, I became housebound. So I'd gone from somebody who, when they're well, will always be out having a walk. Pre-COVID, I go into the gym twice a week. I'm very, very aware, and the prof said to me that apart from the lung tissue with cavities, my lung tissue is healthy. And he said it's very, very important to keep what you've got, so to speak, is what I remember, the essence of what he was saying. So I'm very, very dedicated to keeping fit and walking or whatever. But at this point, and I think it was the same until probably, I don't know, January-ish, I don't know, I wasn't walking outside because it felt pointless, and I would see people and they would expect to chat and it was too uncomfortable. So yeah, I became housebound and walked around the garden. It's really, really awful and so scary because I'm used to my chest being up and down. I'm used to that. But this was down and down. I mean, I'd gone from, at least normally with a chest infection, I can potter around the house, I can cook meals, I don't maybe do any major housework. But this was a case of sitting in the sewing room, not really achieving anything. And then my back would ache, which is, a factor with CPA. I don't know, maybe ABPA, I'm not sure. Awful lung pain in the back, like a sort of toothache, sort of grinding pain. And so I thought, oh no, I can't sit in the sewing room anymore. I need to go and sit on the sofa where I can really relax my back into the sofa. And I thought, is this it? Is this my life? Because I am aware that I'm running out of medications. Either I'm resistant, well, the fungus is resistant, or my liver reacts. I've already said I don't work, which at 63, it's fine now, doesn't really matter now. Husband's retired too. It's minor events. I go to sewing clubs. There are some ladies a little bit younger than me. There are a lot of ladies probably 10 years older than me. Some of them not very fit, some of them reasonably fit, go line dancing and such. And they will all go off to a conference for Quilters Guild or whatever. They will go like the other end of the country. They'll go to, I don't know, I'll say Suffolk, they'll go up to Cambridge or somewhere. Drop of a hat, even during COVID when it's allowed, they're like, yep, we're off, going to conference, just stopping over, mixing with people from all over the country. And previous to COVID, people from abroad too, with all sorts of viruses that worry me. I don't do that. I have been once to the NEC for a quilt show, very anxious about people coughing around me. It's very crowded. I don't like that. I can feel when the air gets fuggy with breath, and I don't like that. I feel it impedes my breathing. I don't know if it does. I just don't like that. There's a quilt show twice a year, about an hour and a half drive from here. I have been a few times. I've driven myself once. But again, I feel a lot of the times I'm like a meerkat. I'm sort of looking out. I'm looking out for people that are coughing, people being too close to me that I don't know. I'm looking to make sure if it's in a marquee, which it is in the summertime, it's a hall and a marquee extended. I'm looking to see if the marquee has got any mold stains, any damp stains. It's awful. It's just life. It's life limiting, not life limiting. Well, it is. I'll probably die sooner than I'd like to, or be unwell, very unwell, sooner than I'd like to. But it's life limiting even when I'm well, because there's so many constrictions. When I'm well, I'm quite happy. I'm very happy, really. Living my my local life, and I've accepted things more and more. And I do remember thinking to myself a few years ago, it's a very quiet life in lots of ways, but sort of inside, I don't know if I'm dancing like crazy or screaming like crazy. I'm not sure. And it's not good, really, I don't think. But I've sort of accepted that this is it. You can't keep thinking, this is not fair, my life is ruined because of this disease. There's no point to it, because it is what it is. I have got it, and I feel very strongly that you just have to make the most of what you've got. You have to accept it, and you have to just plow on, really, and make the best of it. I mean, there is a lot that we can all, with aspergillosis, that we can all do for ourselves. You know, I mean, even with asthma, I think I was told donkeys years ago, you need to eat healthily. You need, whereas 5 portions a day is okay, you probably need 9 or 10. And because I'm always desperate to make myself as well as possible, I do that. I eat super healthily. Exercise is a massive thing. I know more and more now. Asthmatics even are told to, I say even, I mean, asthma is a serious condition in itself. Are told to exercise. When I was in school, going back quite a while, I was told don't exercise. Games teacher would be like, oh, you sit there with all the other sick people, which is obviously the worst thing I could have done. You sit there and, you know, they do whatever. And when I can remember asking, when I was felt particularly well, could I just play badminton? And it was like, oh, I can appreciate it. The teachers were afraid. They hadn't seen me have an asthma attack, and they didn't want one happening on their watch. But luckily, it didn't make me think. I suppose we did activities as a family, just walking and that sort of thing, days out and walking. It didn't make me think I shouldn't exercise. I have rescue pack, my rescue pack in the cupboard. During COVID, touch wood, I've not had chest infections, so I've not needed to take it. That's antibiotics and steroids, and yeah, I'll take them if I need them. See the GP at the same time, of course. But yeah, so I have got strategies in place. I also take gamma interferon, and I feel in charge of that. I get it prescribed locally, and I liaise with a respiratory pharmacist, and I will tell her when I need things, and I'll go and collect them from the hospital. And yeah, that's good. I feel kind of in control of it. What does frighten me going forward, I say I feel quite well at the minute. What does frighten me is, like I think I've said before, running out of options. I am just feeling, I don't know, I'm hanging on by my fingernails, waiting for the next drug to be passed. Yeah, so I'm hoping that my next serious downturn will coincide with there being a new drug available, with fewer liver side effects. The other side effects, the stomach problems, the tiredness, the hair falling out, you can cope with. But obviously, if my liver's reacting, I suppose it becomes dangerous. So, you know, that's that really. So that's probably where I am, in that I do everything I can possibly do. I do everything I'm told might help. I'll do it all. But at the end of the day, I've still got, I had 3 when I was diagnosed, 3 aspergillomas, 3 fungal balls. I had 3, 2 in one lung, 1 in the other. So I was told surgery wasn't an option because I wouldn't have enough good lung left. And I don't know. I'm assuming around the time of the hemoptysis, a couple of months after that, I had a CT locally, and I was told I have a new fungal ball, and they've now evened up, and I've got 2 in each lung. I don't know the size of it. I personally don't like to focus too much on the sizes of them. But yes, I've now got 4 fungal balls, and yeah, apart from the ABPA. So yes, I am hoping that there is a drug coming along without too many side effects. I mean, I know there is a drug left, but I don't think it's very pleasant. And even if I have the inhaled form, I'm just thinking that's going to have restrictions on my life for timings and such. So, but I don't need it at the moment. So, hey ho, we just crack on with what we're doing at the moment, and just hope, that when I need it, there will be something there.